Good morning, everyone. This morning, I'm going to be presenting at the North Shore LIJ Pediatric Conference for 2015, Vulnerabilities in the Pediatric Population. It should be an exciting morning, and I'm going to have the privilege of being able to speak to nurses about good self-care and share some Eastern approaches to wellness, specifically mindfulness and feng shui. So I'm excited about that. It should be a little bit of a departure from what I'm usually talking about and a little bit more fun, hopefully. So I just listened to a presentation by Cara Santucci, who is a counselor with the Child Abuse Prevention Services, CHAPS of Long Island, and I have to tell you, it was quite moving. Cara, quite moving. So I'd like you to just talk a little bit about what your program is and the services that you offer children on Long Island.
Great, thanks Phyllis. So here at CAPS, at Child Abuse Prevention Services, we've been around since 1982. We provide programs for school-age children from kindergarten to 12th grade in Nassau and Suffolk County. All of our school-based programs are free for kids. They're not auditorium, large assembly programs. They are classroom-based programs where students actually participate and are part of the learning process. We are a huge believer in preventive education, so we want to get the message out to kids that when they recognize something, whether it be a sign of abuse, physical abuse or sexual abuse in a friend, that they can be a helper and that they can stand up for other kids. Right. We do a lot of work in bullying prevention, a lot of staff training, parent education training. We also have a helpline. We have two helplines. We have a bullying helpline and a child abuse and neglect helpline. They're not 24-hour hotlines, but they are helplines where we provide guidance and help for people to navigate them through the process. And we also have programs like SUS, Students United for Safe Schools, which is a team building approach in middle schools and high schools across Long Island. It's based on social norming theory, where we engage students to become the active agents in their school to unite school community.
Well, I can't thank you enough. You had a room full of pediatric nurses, absolutely spellbound by what you had to share, and just can't say enough about the program and the services that CHAPS offers. So how about the phone number?
Sure. Our website is www.capsli.org, capsli.org. Our phone number is 516-621-0552, and please give us a call. We'd love to help.
Thank you so very much.
You're welcome.
Wonderful.
Thanks, Phyllis.
Well, we just heard a wonderful lecture from Regina Muir, certified nurse practitioner in pediatrics, about asthma in the pediatric population. Regina is an NP in private practice. And Regina, I'd just like to ask you, what are some of the challenges that you're seeing in private practice, especially as we're coming into the cold and flu season?
I think one of the biggest challenges is for the patient and the family is realizing that they actually do have asthma, or know the symptoms that they're looking for. We have a lot of patients who come in who are exhibiting the symptoms of asthma, but they don't typically know that. They just think they're coming in for a cold, or they haven't started their medications. So trying to teach them that these symptoms they're seeing really are the beginnings of asthma exacerbation. And our goal is to manage them as outpatients. We don't want these patients to be hospitalized.
Right.
To try to keep them as healthy as they can be during the cold and flu season and that high allergy season, which we're in now.
Right. I know in the Future of Nursing, 2010, it started talking a lot about the role of the school nurse and what the future of school nursing would be, and perhaps it's time for NPs to go into school nursing, or at least have the role of the school nurse expanded. How would you think that would play with asthma?
I think asthma would be a great place for the school nurses. We every day I'm writing an asthma action plan or guidelines for the school nurses to use for the patient when they're in the school. So making sure that the patient, when they come to us for their checkup, or having the right prescriptions, having the medication in the school, having the spacer or the nebulizer equipment in the school, because a lot of times it is the school nurse who is picking up that these children are not doing well during the day.
Right.
So I think, and they're the ones many times sending them to us. I've had patients that have come in because the school nurse has required that they come in.
Right.
and that's what the catalyst was for the parents to bring them in.
Right. Well, with most chronic diseases, that's an ongoing challenge and certainly quite stressful. So, like most nurses, you have a couple of lives. You have
Yes.
a private life. You
Yes.
work in an emergency department. You're an NP in private practice. How do you take care of yourself? What are you doing for good self-care?
I probably don't do as well as I should do. I'm probably the typical nurse. I do a lot of volunteer work. I volunteer with the homeless. There never seems to be enough hours in the day. It's something I definitely have to work on.
Right.
I feel sometimes like I don't practice what I preach.
There you go.
the others,
Okay. Well, that's very brave for you to say and very transparent. So hopefully you will do that.
Yes. I'm going
Okay.
to get my flu shot next week.
There you go.
But
Great.
I haven't even gotten it yet, which is
Great role
given
modeling.
it for many weeks.
Okay. Excellent. Thanks so much, Regina.
Thank you very much.
So the Pediatric Conference for 2015 is over, and I have the pleasure of sitting with the planning committee, Sharon Goodman, Heather Green, Suzette Monteleone, and Kathleen Wagner. And I am just, gals, what a job and what a day. It was fabulous. So, you're pediatric specialists, all right? And I just really, as nurse educators, want to ask you, are you hiring new graduates? And if so, how are you preparing new graduates to specialize in peds right out of school?
So I will answer that. We
Okay.
definitely are hiring new graduates. We've been hiring them for several years now. We have specialized programs for all of our pediatric specialties, whether it's the neonatal intensive care unit, pediatric critical care, hematology oncology, medical surgical, and we do have fellowship programs for the pediatric intensive care unit as well as the emergency department and our hematology oncology unit. For the remainder of the orientations, we have comprehensive extended orientation programs to prepare the new graduate for this role. We do realize that there's not a lot of pediatric component in the academic facilities preparing the RNs coming into this field.
Right,
So
right.
we do have prolonged, extensive pediatric training available to them.
Right. So, one of the things I heard at the Nursing Education Conference was a dedicated education unit, a DEU. Do you guys have DEUs at Cohen, and are you talking to any academic sites thinking about either anchoring that or creating that?
Currently, we do not have any designated education units. We are working with Adelphi as well as Malloy to look into this to see if this is an option for our students.
Okay, great. So, Sharon, after all this hard work, all right, what's the one thing that you were hoping the participants took away from today?
So I think the theme was really about safety, how we can keep our children safe. So through anti-bullying, through injury prevention, and then how to keep ourselves safe too, our wellness. So I hope they took away for their patients and for themselves.
It was definitely the theme, and I think it was really well received. Really well received.
Thank you.
Okay. So, and what would you say, Heather? I'm sorry. Heather, help me here. How long have you been in pediatrics?
For about 8 years.
For about 8 years. Did you start exclusively in pediatrics?
I didn't. I started in antepartum, postpartum.
Okay, so you were a maternal child?
Yes.
Okay, so why the switch to peds? And if you were to encourage another nurse for considering the specialty of peds, how would you do that?
I had always wanted pediatrics. I did my last rotation at school, which a lot of the new nurses do, on pediatrics. Actually at Schneider's at the time. So I knew I had wanted that and a job became available, so I had transferred. And I'm very happy that I did that.
You'd encourage others to follow suit.
Definitely. It was a good choice. I'm happy I made it.
Very good. Okay, Kathleen. All right. Something on self-care. What would you recommend that pediatric nurses do in order to be able to really stay in their compassionate hearts so that they're available? Because let's face it, pediatrics means very much not only patient-centered care, but you're so involved with the families. And I heard you say to me, if you didn't engage with the families during a shift, you didn't feel like you went to work. So talk to me about that.
I think connecting with the families is the biggest part of being a pediatric nurse, and connecting with them kind of helps you take care of the patient themselves, and also kind of gives you a peace of mind knowing that you're able to care for that family, and gives you a
accomplishment feeling when you're done at the end of the day, that you were able to come full circle, care for the patient and care for the family at the same time.
So there you are at work, perhaps with a critically ill child and a family surrounding them. What do you do at the end of the day to take care of yourself?
I just reflect back on the day and see what I did to make a difference in their lives and see that it fulfilled me at the same time of fulfilling them, and then go home and hug my kids.
There you go. That's right. Then you can go home and hug your kids. So Suzanne is also the Director of Education over at the Cohen's Medical Center. So what's on the forefront, Suzanne? What do you see with all the things going on in Cohen and now with the Trauma Center designation? What's going to be the challenges for your team?
So we are especially excited about spreading this great work throughout the service line. So we have started to touch the pediatric service line as far as orienting nurses throughout other facilities in the health system. Sharon actually is our service line coordinator. So we really want to make sure that every child that goes to a hospital in any part of our health system is going to receive the same great care.
So we're talking about education without boundaries or education without
Got
walls?
it. Yes, education without borders. We do host currently orientations on site for several of our facilities, whether it be a new grad or an experienced grad who's coming back into pediatric nursing. So we offer them the opportunity to come to Cohen's, being we are a high volume.
Right.
And we see most critical pediatric patients to experience the orientation here.
Right.
And now we're looking again to really take our standardized practices throughout the health system to other pediatric institutions.
Well, I just, as an educator, a grandmother, I just really want to thank you all for the hard work that you do to really bring up the quality of the pediatric care. Bless you all and have a really, really good night.
Thank you.
Thank you.